Hi, my name is Jackie Zach, and I'm a rising sophomore at Bucknell University studying biomedical engineering, and I am researching deep brain stimulation of the subthalamic nucleus and its effect on gait disturbances in Parkinson's disease. The subthalamic nucleus, or STN, is the standard target for deep brain stimulation, or DBS, for Parkinson's disease. DBS is a neurosurgical procedure where electrodes are implanted into the brain. Electric stimulation from DBS alleviates many of the motor symptoms associated with Parkinson's disease, including gait disturbances. A generalized stimulation approach may not be optimal for every patient due to the diversity of their symptoms. The goal of my project was to identify the ideal stimulation spot for STN DBS to treat gait disturbances in Parkinson's disease. My project utilized patient-specific imaging data from a retrospective study of 40 Parkinson's patients with 72 implantation sites. I quantified the overlap between the volume of tissue activated, or the VTA, and the STN to determine STN activation in the lateral medial, anterior posterior, and the dorsal ventral directions. The first figure on the left shows the overlap between the VTA and the STN, which is the area where this analysis is focused on. The figure below shows the split between two halves, anterior and posterior in this case. After calculating the STN-VTA overlap, I performed correlation analyses between the STN activation and symptom improvement for 4 symptoms: gait, freezing of gait, postural stability, and total gait, which is a combination of the first 3 symptoms I listed. In the results section, each row corresponds to a specific symptom. Scatter plots for anterior-posterior STN activation are the first 2 figures in each row. I then grouped patients based on where the majority of their overlap between the VTA and STN was located relative to the center of the STN. I used the Wilcoxon rank sum test to compare symptom improvement between groups. The box plots in each row show the difference between percent improvement for each symptom in the anterior-posterior direction. I found a significant positive relationship between anterior STN activation and gait improvement, and between anterior STN activation and total gait improvement. Additionally, I found significant difference between majority anterior and majority posterior STN activation for freezing of gait and total gait. These results suggest that more anterior STN stimulation may be preferable to posterior STN stimulation for patients whose primary symptoms are gait disturbances. These findings are important because they provide evidence that a patient and symptom-specific approach may result in better outcomes than a generalized one. Thank you.